A lot of custodial deaths occur due to the suffocation. It's also one of the kind of the tortures that that the prisoners can be subjected to, in which the people have been basically devising the mugging phenomena as well, and as well as a lot of positional asphyxia or positional asphyxiating conditions have been devised. For example, a lot of positions such as the knee to heel positions are one of the positions that can prove to be quite asphyxiating for the people who have been subjected to torture. And then we can have a lot of positions, for example, that have been already discussed in the previous section. That is the falanga. It is one of the positional asphyxiating condition in which a lot of evidence cannot be present, and the police officers who are subjecting the people to tortures in such a way have been hiding out, because apparently the person dies due to some natural cause or some due to some underlying diseases, but the cause is sometimes something else, that is the torture, or the torture cells prove to be fatal for the prisoners. So it is quite inhumane, and but these practices are present in a lot of countries, and a lot of countries basically devise these methods to carry out such processes. And that deaths from burns, it's again another procedure that is being carried out in such a case. And burns are basically the prisoners are being burned, and they can be a superficial kind. For example, scalds can be present in a lot of people, and then we can basically divide them or distribute them into first, second, and the third degree burns again. So all of these are basically a part of the torture procedures that are being carried out in the interrogation cells. In this section, we are discussing, or we are basically focusing on the burns presently, and then the deaths from the suffocation and the drowning. So these are again another procedures that we have to keep in our mind, that a person can be suffocated to death, or drowning is also another feature that is quite evident over here. So, burns can be like quite common over here, and the actual cause of death is sometimes quite difficult to get to whenever we are talking about burns. Burns basically occur whenever the skin temperatures are, whenever the skin is exposed to temperatures more than 40 degrees centigrade. So, it's basically the cutoff line. The person is being subjected to such hot burns or hot substances or hot liquids. Even liquids can obviously produce scalds, and that is the reason in a lot of cases over here. So a common condition, that is the actual cause of death, sometimes it is not present over there. The person can go into shock, into a dehydrating condition, or sepsis can occur. So the underlying baseline causes are going to be there. The pain can be one of the causes. It can be hemorrhage, it can be the sepsis that can result through these burns, and that will basically be the underlying cause of death in such people. Then burns are quite evident, and evidence is present on the person who has been subjected to such kind of torture. So it is sometimes quite easy to just get through that visible evidence, and visible evidence is always present in such cases. So, ignited kerosene, soaked rags, and cigarettes. So, we have to keep in our mind that all of these things, that liquids can be present, even boiling liquids can be a cause of these burns. Ignited kerosene can be a cause of these burns, and soaked rags. Soaked rags, basically, they are soaked in the boiling water, water at the boiling point, and the rags are soaked in that, and the person is subjected to such kind of rags, and that is also going to result even in the third degree burns. So first degree burns are basically going to be at the superficial level, and then we have the second degree burns involving the subcutaneous fatty layers as well, and then some layers of the muscle as well, and then the third degree burns are basically going to involve the muscles and the bones as well. So that is basically going to be a scar, that is going to result in a scar tissue, or which is also known as the keloid formation. Now, if there is a delayed examination, sometimes this torture, after being subjected to this kind of a particular torture, the person is sometimes, or the dead body is sometimes hidden somewhere in the torture cells or in the prisons. And after some time, they are they just show that this person has died or this prisoner has died, but the time since death can be calculated, and the time since death for the injuries can be still calculated. If they are healed, or the keloid scars have been formed, then that basically indicates that this is basically a delayed examination and the person or the prisoner has been hidden somewhere from the authorities or from the higher authorities by the people who subjected him to severe inhumane torture. So one has to be quite vigilant while carrying out, if you're carrying out any investigations on any torture cells, or the criminals, the police officers out there who are basically performing these inhumane tortures. You have to be quite vigilant while visiting their cell's office or while visiting their torture cells, and get a complete investigation and get a complete evidence for the tortures that they performed during the investigation period. So, burning motor tire necklace. So, it's basically a motor tire necklace. It's basically that the rags are being tied around the limbs, that is, the upper limb or the lower limbs, and that basically forms a motor tire necklace form of burns. The shadow areas indicating the contact direction. So it's again very important that you basically highlight these shadow areas for the contact with the hot surfaces or the hot rags, and you just highlight that these areas were involved in the burnings. The scarring in all but most superficial burns, of course, it's again one of the parts that one has to be subjected to. Now, the large unsightly cicatrized areas. So it's again very important just to highlight that these cicatrized areas are again very important while we are performing these burns procedure. Now, the deaths from suffocation and drowning. So it's also one of the method that during the custodial periods, the people are subjected to suffocation as well as they're subjected to that drowning phenomena. So suffocation, as I've already highlighted, it can be devising methods such as mugging, or it can be some sort of a positional asphyxiating kind of conditions. For example, the a knee to head position can be sometimes asphyxiating for the people. So all of these conditions, or the heavy weights on the chest, can be sometimes suffocating or asphyxiating for the prisoners as well. So basically all of these will inculcate these suffocating phenomena, and then we'll move on to the drowning phenomena. Sometimes the head is being pushed into a bathtub, and that is basically a part that is also going to basically suffocate the person, or it is also going to be one of the kind of the suffocation or the asphyxiating conditions. Now, it is not common, it is not commonly carried out. It is a well-known method of abuse that is being carried out worldwide by the torture cells, and the submarining is also one of the phenomena. In it, basically, it is not actually a submarine, but this kind of a torture is known as submarining, in which basically you repeatedly dip the victim's head underwater. So it's basically quite painful for the person because it is suffocating for the person, and it's part of the interrogation cells. Even fouled liquids such as sewers, and all of these are used for the dipping. It is not always water. It is sometimes quite a foul smelling liquid, and is quite torturous for the person or the prisoners. Now, the drowning is one of the method of this torture cells, and then the air passage occlusions. So it can be the gagging phenomena or the choking phenomena by putting pressures on the neck or by putting pressures on the chest as well. And then we have the latent pneumonic conditions that are again also being part of this. And then we have the opaque plastic bag conditions, in which basically you suffocate the person by placing the plastic bags and covering the external orifices such as the nostrils and the mouth are being closed, and thus the person is unable to inhale. They are basically the means of disorientation. The partial suffocation is a part of this procedure and proves to be quite fatal for the person. So that is basically, this is what we discussed over here: different kinds of torture cells, and the suffocation, drowning, burns. All of these are being the victims are being subjected to these kind of tortures, and they're going to result in to prove to be fatal for the person. That is the end to this section. Thank you for watching sqadia.com.